Mr. Murali-Pillay.
Question 6, please.
Question. Sorry, question 4. My apologies.
The National Environment Agency has reported 2,200 cases of dengue in the first quarter of 2019. This was more than 3 times compared to the
Minister,
same
are you
period.
taking question 4 and 5 together?
My apologies, Speaker. May I have your permission to take questions
Yes,
4
please.
and 5 together? This was more than 3 times compared to the same period in 2018, but below the number of cases reported during the epidemic years of 2013 and 2014. Neighbouring countries have also reported increases in dengue cases in recent months. Contributing to this situation is a persistently high Aedes aegypti mosquito population in the community, as detected by the NEA Gravitrap surveillance system. As a regional transport hub, Singapore is vulnerable to the transmission of infectious diseases. NEA and the Ministry of Health, MOH, have put in place a robust surveillance system to detect dengue and other vector-borne diseases. This system comprises vector surveillance, virus surveillance, and dengue case surveillance. NEA has an island-wide network of 50,000 gravitraps to monitor the mosquito population, and will add another 14,000 gravitraps in the second half of 2019. Data from this network guides NEA's vector control efforts, allowing officers to quickly zero in on the areas with high mosquito population. NEA's laboratory-based virus surveillance system monitors dengue virus serotypes and provides early alerts when there is a serotype switch. Historically, such switches have preceded large dengue outbreaks. Further, NEA, together with the National University of Singapore, has developed a model which helps us to forecast dengue incidents. This allows NEA to coordinate an effective preemptive response to impending dengue outbreaks. NEA anticipates an increasing trend of dengue cases in the warmer months ahead and has taken concerted efforts to stem dengue transmission. First, NEA, together with various agencies represented in the Interagency Dengue Task Force, have stepped up efforts and checks and conducted more than 224,000 inspections in the months leading up to the peak dengue season. About 2,900 instances of mosquito breeding were removed. Second, NEA brought forward the launch of the 2019 National Dengue Prevention Campaign to the 7th of April this year. Together with grassroots advisors and leaders and dengue prevention volunteers, NEA has been raising awareness that clean and stagnant water in homes are potential breeding habitats for mosquitoes, and galvanizing the community to step up dengue prevention efforts. More than 8,500 volunteers have been trained to conduct patrols and house visits to share dengue prevention tips with residents. Technology and innovation is another key pillar in dengue prevention efforts. NEA is conducting trial releases of male Wolbachia-carrying Aedes aegypti mosquitoes to further suppress the urban Aedes aegypti mosquito population in the community. NEA has successfully completed the Phase 1 and 2 field studies for Project Wolbachia Singapore. The Phase 1 field study was conducted from October 2016 to December 2017, and a 50% suppression of the urban Aedes aegypti mosquito population was achieved. More importantly, this initial phase provided NEA with valuable data on the behavior of the Wolbachia Aedes mosquito. This has helped NEA to design more effective release strategies for Singapore's high-density and high-rise city environment. As a result, the Phase 2 field study conducted from April 2018 to January 2019 saw a significantly higher level of dengue vector population suppression of 70 to 80%. In this phase, NEA expanded the size of the study sites and released male Wolbachia Aedes mosquitoes at higher floors, in addition to releases on the ground floors. The results showed that a larger release site yielded improved population suppression results. The Phase 3 field study has started in February 2019. NEA has further expanded the study sites at Nee Soon East and Tampines West by 1.6 to 2.2 times. NEA aims to determine if suppression of the Aedes aegypti mosquito population can be sustained in larger areas, and if a smaller number of male Wolbachia Aedes mosquitoes can be released at each residential block to maintain the suppression. NEA is also developing automation for male Wolbachia Aedes mosquito production and release to ensure scalability of the technology. NEA will evaluate the Wolbachia Aedes technology carefully and rigorously before deploying it on a large scale. NEA will continue to provide regular updates on the progress of Project Wolbachia. I would like to take this opportunity to thank all our stakeholders, our local advisors, grassroots leaders, and volunteers for your efforts in our dengue prevention initiatives. We continue to see many cases of mosquito breeding in homes. All it takes is a small amount of water the size of a 20-cent coin for mosquitoes to breed. With a short breeding cycle of 7 days, keeping the mosquito population in check requires the joint effort of every individual and stakeholder in the community to eradicate mosquito breeding habitats by practicing good housekeeping and doing the 5-step mosey wipeout. The government alone cannot prevent dengue transmission in Singapore. We must remain vigilant and work together to keep dengue at bay.
Mr. Alex Young.
Mr. Speaker, I thank the Senior Minister of State for her update on Project Wolbachia Singapore. I have 3 supplementary questions. The first is, why has the study taken so long, as the start of Phase 1 was in October 2016, and it's been almost 3 years now. Compared to many other countries, we seem to be slower in our pace of introduction of Wolbachia as a dengue and Zika suppression method. Secondly, the Senior Minister of State talked about scalability as well as sustainability of releasing male mosquitoes. My second question is, will the NEA consider adopting the World Mosquito Programme's Wolbachia method, which is to release both male and female Wolbachia mosquitoes so that it is self-sustaining? And this has found success in several hotspots internationally, including Australia. My third question has to do with availability of information on Project Wolbachia, as well as educating the public. It seems that the public is aware of various methods, but may not be so clear about the benefits of Wolbachia. In Australia, for example, they involve school students as part of the release of male Wolbachia mosquitoes, so that they bring the message home to their families as well. So whether NEA will consider expanding on the education and information available on this project.
We thank the member for his 3 supplementary questions. Firstly, regarding why it has taken us some time to implement Phase 1 to Phase 3 of the Wolbachia technology project. Firstly, let me say that we are actually adopting a systematic phase approach for the field trials because we need to study the various aspects of using this technology. In fact, as I've said in my answer earlier, when we did phase 1, it gave us valuable information on the deployment of the technology, particularly because I think we are the first in the world to implement this technology in a tropical, highly urbanized and highly dense landscape. And from the information that we got about the behavior of the Wolbachia, the male Wolbachia Aedes aegypti, we were able to then implement phase 2 in terms of where to deploy these mosquitoes, so higher floors and also the lower floors, as well as having larger areas and buffer sites to improve the suppression of the Aedes aegypti mosquito population. So for the phase 3 field study, as I've said, what we aim to do is to determine how the suppression can be sustained through the seasons of the Aedes aegypti mosquito population fluctuation, and also over a larger study area, and as well as to determine the number of male Wolbachia Aedes mosquitoes that is required to sustain the suppression that has been achieved in phase 2. And that's why for phase 3 we have actually expanded the study sites, the same study sites, but to a larger area, 1.6 to 2.2 times. And as I've said, we want to carefully and rigorously evaluate the results to see if the suppression can be sustained before we consider deploying this on the larger scale. In fact, let me say that to our knowledge, for countries that have actually adopted the Wolbachia technology, even though the technology has developed quite quickly, none of them has actually gone beyond field trials into full-scale implementation. Australia, I understand, has completed the field trials, but they have not made an expanded the project. And even in Guangzhou, what they have done is similar to Singapore. They have actually just expanded the field trials. Another point I would like to highlight really is that the Wolbachia technology is meant to complement and enhance our existing vector control strategies and not to replace them. So source reduction and so on are still important, critical, in fact, to the success of this Project Wolbachia technology, and will have to continue to persist in order to restrict and reduce the number of dengue cases. Regarding education, first, before the second one, let me say that we are working on educating both the residents within the field trial study sites as well as the general public through various means, through mass media, for instance, articles on the Wolbachia technology, through community outreach events, as well as through seminars. So since 2012, we've actually organized more than 100 seminars and outreach events to reach out to the academia, the medical and healthcare professionals, the teachers, the students, NGOs, grassroots leaders, members of the public and residents. And in fact, we also have a Project Wolbachia learning journey, where we offer to members of the public, students, residents from the field area, for instance, study area, for instance, to visit our mosquito production facility so that they will have a better understanding of the processes involved in the production of Wolbachia Aedes aegypti mosquitoes. And we will continue to do that. With regards to scaling and sustainability, I think I have actually more or less touched on the question.
Mr. Melvin Yong.
Thank you, Speaker, and thank you, SMS. Many of the private condominiums in my constituency, and I have many, are stepping up anti-mosquito fogging. And it has come to a point where there's some kind of fogging almost every day. And the residents tell me if I don't fog, then the mosquitoes next door will come over to my site. Right? So I have two questions. One, can Ministry explain if this fogging is useful and is effective because I have some understanding that the mosquitoes will eventually become resistant to some of the chemicals being used. So that's one. Two, because there's so much fogging taking place and it's becoming like a competition, can NEA consider coordinating such fogging activities in private estate cluster where there are quite a number of condominiums and they are all fogging at some point in the week, and if it's effective, then I think we should do something about it. And in fact, if somebody coordinates, then if we can aggregate demand, it may also bring the cost down for the area or for the estate itself. Thank you.
I earlier said in my reply that we have a gravity trap surveillance system, and it is deployed island-wide, and the idea is to identify where there's a high concentration of Aedes aegypti mosquito population. So fogging is normally used when there is a dengue cluster. So you want to, because fogging and misting is to kill the adult adult mosquitoes, and where there could be a high concentration of mosquito population. I think the most effective and primary method really is source reduction, that is preventing mosquito breeding rather than fogging and misting. But there is a use for fogging and misting, as I said, dengue cluster as well as high concentration. And then when there's a dengue cluster, you also have indoor space spraying in order to kill the adult mosquitoes which may be infected. As regards competition of fogging, I think the fogging schedule is determined by the MCs of the condominium. So they need to, decide if there is a real need to do fogging so frequently.
Song Wenam.
Thank you, Speaker. First, I would like to thank NEA for allowing Jurong students and parents to visit the Wolbachia production facility in Jurong. It's very well received, very encouraged by the project. I have two questions to ask SMS. First is that since the production facilities in Jurong, is there any plan to expand the project or budget project in Jurong as well, because they are also dengue cluster? Number two, is there a plan to expand the Wolbachia production facility? Thank you.
As I said, Wolbachia technology is still under development, and at the moment we are undertaking trials and field studies. So we'll have to evaluate the results of phase 3 of the field study carefully, rigorously, before we decide if we should deploy the technology on a larger scale. But at the same time, actually in terms of production of the Wolbachia Aedes mosquitoes, we are actually looking, as I've alluded to also in my reply, looking at the production and release through automation, improving the production productivity or production efficiency, as well as the quality of the Wolbachia Aedes mosquito produced at the production facility. So for instance, we work with various companies like Orino Technology and Verily Science to develop devices, innovative devices, such as a larvae counter, pupae counter and sorter, adult mosquito sex sorter, mosquito launcher, and so on, to make it more effective and efficient in producing these Wolbachia Aedes mosquitoes.